time, and we shall move on to our last speaker and the star speaker, Dr. Kasturi Bhattacharya, who's going to be talking on problems and solutions in ocular aesthetics and expert guide. On to you, Dr. Kasturi.
Yeah. Can you see my slide?
Yes, yes.
Yeah. At the outset, I would like to thank you, Dr. Chitra, AIOS and ARC, for giving me an opportunity. So I'll be speaking on the problems and the solution in ocular aesthetics. Let me start by mentioning that any problem that comes to us, we always question what is the problem, when it occurred, how it occurred. But the answer is one, that we need a solution, we need to revise it. And the second question is that what is the aim of the aesthetic procedure? Is it for symmetry or is it for beautification? For many, the beautification is a combination for symmetry and contour, which I do not agree. For me, beautification is basically alignment and harmony. So I start my talk by quoting Atul Gawande, who has mentioned that no matter what measures are taken, doctors will sometimes falter. Whether you're a very expert surgeon or whether you're just a novice surgeon, you can falter. And it isn't reasonable to ask that we achieve perfection. What is reasonable is to ask that we never cease to aim for it. So in aesthetic practice, whatever is the problem, we need to have the solution, and all solutions should aim for perfection. So as a facial aesthetic surgeon, it has been discussed so well, like we do multiple aesthetic procedure, which can be in the form of injection botulinum toxin type A, which can be for different indication, like for the crow's feet, for the eyebrow, or for the dermal filler, which can be used for a mid-face lift or your lip augmentation, or a chin augmentation, or the slimming of the face. So there are multiple indications and the multiple use for dermal fillers, and every situation you might have a problem, but you should know how to have the solution. And Dr. Deepa has already shown nowadays most of us use extensively the facial thread, and like I really love using it. This is a cork thread that you can see, which is basically used for the facelift, and also you can use the other type of face, especially the twin thread or the mono thread, which are also used extensively. So you can have a problem during the stage or in any of the stage of doing any surgical procedure, like an upper lip blepharoplasty, where you can see when you need to cut the different layers of the upper lip, or even a small procedure like a medial epicantoplasty, where you need to manage the medial epicanthal tendon along with excision or a subcutaneous tissue, or a lower lip blepharoplasty, where you form the beautiful fat pedicles. And what you need to transpose this fat, which acts as a homologous tissue, which acts as an autofiller and fills this tear trough, and down also it leads to good effacement of the late cheek junction. So all these are the multiple procedures which is done by any of the ophthalmologists doing a facial plastic surgery. But what are the main complications that can occur in the form of the bruit, hematoma, asymmetry, infection, vascular complications, and many times over and under correction. So the injection site complications are usually transient, reversible. They usually come in the form of erythema, local edema, bruising, and the solution to it is avoid aspirin, avoid NSAID, avoid the green teas, avoid vitamin E and the other anticoagulant a week prior to the surgery. Use a small gauge needle, and icing, which has already been discussed today, can minimize the pain and also cause a vasoconstriction. Many times, however great you are, you can have complication like in the form of ptosis. You can have also in the form of either a brotosis, or you can have in the form of the late ptosis. But another common complication which can occur in anyone hand is the asymmetry, where you need to do a symmetrization by giving another unit of Botox, and thus you can help and treat the solution. Then other complication has already been mentioned by my previous speakers very well. So we should always understand the patient's psyche, make them a part of the decision making, evaluate the entire face for a holistic appearance, and address the man-made, inadvertent, unintended error. And even if you have a minor asymmetry and imperfection, you should try for harmony. As already mentioned by Aparna, like we all know that this minor imperfections are very common in dermal fillers because it is classified as device and non-medication. Like medication, we have like one tablet TDS, but for fillers, we do not have any volume, we do not have any unit. So sometimes the main complication that can occur is volume too much or too less. The depth can be too superficial or too deep, or there can be also some unfavorable anatomic site injection. And for ophthalmologists, the most common indication for us is the management for the tear trough deformity, which we usually do with a needle. And when we give with a needle injection, we get beautiful results. And this is what most of us practice initially. And you can see here, like this is a girl where I'm trying to manage the tear trough. I'm injecting on one side. And moment I complete the one side, you'll see this is the site yet to be injected. And what you see, the tear trough is being nicely taken care of. You'll see that a good concealing of this eye bag. And this is the side injected, and then you go to the other side. So this is what we do in most of the practice. Initially, all of us have started with the needle injection, and the local site injuries are very common. The complications are very common with the tear. Like you can see, one can be in the form of a lumps and bumps, as you can see here, and there's a solution to it, like the hyaluronidase. And there can be other complication, like this is the case of volite, where you give for the skin, and you can see the small bumps, as you can see here. And also it can form other complication in the form of the Tyndall effect, which is better seen in the daylight, or it can be in the form of an inflammation, or it can be form of a bruise. So what is the solution to this? How we avoid this bruise or lumps and bumps? The best way is by using a cannula, which I usually believe is a very nice way of managing the tear trough, because it leads to a very nice tissue integration. Hardly you'll see any bruise, hardly you'll see any lumps and bumps. And it really gives a very good effacement of the lid cheek junction, manages the tear trough very well. And this is how you see, this is the lady where you can see a little amount of tear trough with the eyelid bag, lower lid bag, and this is approximately 2 days following the injection. And this you can see with this dermal filler, you can really conceal the fat. Adit has shown nice pictures, even the previous speakers, Shubhra, Milin, all have, we are discussing about it. This fillers really conceals the fat and also corrects the tear trough deformity. And also the most important, it makes a rejuvenation of the face, and it converts a negative vector to a positive vector, along with the correction of the tear trough and also the eyelid bags, which can be done both surgically. And the results are instantaneous. You see, this is the point of entry of the cannula, and you can see this immediate following the treatment. You can see so beautiful correction, but you can also have lots of complications, especially in the form of the vascular complication, where the result can be either the local form, where you can have a blanching like this following injury to the blood vessel, or also you can have a remote or a distant effect. However, in the face, we are very lucky. We have the angiosomes, and this has both the choke anastomosis and the true anastomosis. The advantage of having all this angiosome is that in most of these angiosomes, we have the choke and the blood vessels. So whenever these blood vessels are touched by the filiary ambigospasm, so this leads to a local effect in the form of necrosis. But in case it enters a true anastomosis, it might lead to unrestricted flow through the same side or to the opposite side till the point of retrograde flow, and this leads to blindness. So what is the solution? The filler crash kit, where you need to have the hyaluronidase, you need to have the steroid, you need to have the nitroglycerin gel in case there is a CRAO. You need to have a paracentesis set, all the antibiotics, and also the hyperbaric oxygen. And when there is a vascular complication, you need to flood the area of the vial, because along with the occlusion of blood vessel, there is so much of release of anti-hyaluronidase substance. So you really need to give in excess in order to overcome the vascular complication. And hyaluronidase itself has got so many complications, like this lady, as you can see, definitely in the COVID era, she came with the inflammatory nodule that you can see here. And this is when I managed this inflammatory nodule with the hyaluronidase, and you can see a delayed type of hypersensitive reaction, which occurred after 48 hours. And then again managed her with the steroids, the hydrocortisone, and she came back to the original shape, but definitely with the steroid phases. Surgical complication can be very early complication in the form of swelling, in the form of hematoma, but these are all manageable. And the most common indication for all of us for upper lid blepharoplasty is to treat have an eyelid crease or to have managed the lateral hooding. But sometimes, in spite of being in the best, do the best surgery, you can have asymmetry like this. This lady comes to us, comes to me with the asymmetry after a month. And when I was looking to her, I was liking the left side, but she was liking the right side. So we were deciding which side to correct. Ultimately, we decided that we'll correct the right side. And this is after the correction of the right side. And ultimately, you can manage it and you can have a symmetrized eyelid crease in both the sides. This is another very interesting young girl. She comes to me for upper lid blip. And this is what you see. You can see a scar. When she looks down, she was very conscious about it. And then I had just injected, 5FU with tricot, and the scar got revised. And this is before just the scar. And this is when she looks down, the scar is totally absent. So all this can be managed. And this is another lady who came for the upper lid blepharoplasty. I had done an extended upper lid blepharoplasty because of the lateral hooding. And what you see here, there has been an incomplete correction of the lateral hooding. So I had taken up very early for revision surgery. And this is what you see, that sometimes you need to take them up for revision surgery when you have a very demanding patient like this lady. She happens to be a very prominent part of a lady from Mizoram. And this uncorrected, which I had again taken up within a 10 days time. And this is the final look that she gets it after the second procedure. This is a very interesting case. She comes to me for her upper lid blip, and this is what we usually say, that we need to give a monofilament suture to suture the skin, and this is a reaction to proline. And this is something very rare I have seen, and this is a proline reaction. And once the proline has been removed, and she was on local steroid, and this is how she looks after a month following this reaction. Similarly, this is very interesting case. This is a xanthelasma, and again, all the skin being sutured with a proline, and this is again the proline reaction that I have seen, and I have removed the proline, and you can see this swelling. Immediately the proline was removed, and ultimately she was on steroid, and this is the final look following all this complication and solution. Lastly, like we are all very fond of, and when we all started blepharoplasty, we used to excise all the fat bed. But what we have seen, that especially in Indian scenario, if we excise all the fat bed and do not transpose or do not use the fat as a filler, then you can have something like this hyperpigmentation and also more hollowing of the inferior orbital rim. So these are the indication where we go for post blepharoplasty augmentation with injection dermal filler. And this lady, we have to following the blepharoplasty 3 months after the blepharoplasty procedure, you can see a dermal filler has been injected again with a cannula, because I always feel the tissue integration is better, and especially post-surgical, the cannula is much better than the needle. And this is how she looks immediately after the injection of the filler following a post-blepharoplasty augmentation. And you can see the pigmentation is much less, and also the hollowness has much less, and she looks a totally different patient after multiple sittings of filler following the blepharoplasty procedure. So what at the end, I would like to mention that whatever the problem, we should be a part of the solution. We should place ourselves in the same situation, and the patient be a part of the solution, and you should focus on the solution and not on the problem. Thank you very much for your patient hearing.
Yeah, we always keep for the best for the last, and it was truly a very good talk. I know you had to rush through it, but it was just really wonderful. Dr. Shubhra, would you? Yes, I have a question before we conclude. What would be your message to the young ophthalmologists who aspire to come into your specialty?
Regarding the aesthetic practice, right?
Yes.
I feel that every specialty is very important and holds equal importance. And the most important thing, that you should have a passion. You should have a passion that you want to do, because it's very easy to do a reconstruction when a face is already deformed and you do a little correction, the patient is happy. But when you work on a normal face, and to beautify the normal face, the most important thing that you should have a very clear understanding of the anatomy. You should know your anatomy well. You should do lots of cadaveric dissection, and you should have lots of training and practices before you take up all this challenging case. So when doing a LASIK, when we do a LASIK procedure, this patient already have vision. So we are working on a normal eye. Exactly when we do a cosmetic procedure, we work on a normal face, and only we are giving a more rejuvenation. So you should be very truthful to the patient. If you feel that at some point you need some more training, you should not touch the patient unless and until you're confident that I can do a good job and I can do an honest job for the patient.
Yes, wonderful. Dr. Shubhra, you have anything to ask?
After Dr. Kasturi's talk, no way. No way. I think it was a wonderful talk, I think.
Yeah.
So I think we, Raman, Dr. Kamalpreet, if you have any comments, please, please share.
Dr. Kasturi's talk is always mesmerizing, and it's added up on with such nice pictorial and other videographies and all. So it was all wonderful and informative sessions. Many more things to learn. Always, it is never that we are done with the learning part. And every time I be a part of these type of sessions, I think that I'm still learning. And thank you very much, everybody. I have no more comments to make.
I'll just like to say one thing. As usual, hats off, Kasturi. This is just a very random comment, but I think it's very apt here. Maybe like 10 or 15 years ago, cosmetic surgeries and cosmetic procedures were not really considered very mainstream, or were not really, let's say, not respected very much. So, but now, as our social demands have changed, so like a lot of people identify themselves by their profile pictures or by their, Instagram followers. Most of us meet other people on Zoom meetings. So it really, meetings like this, sessions like this are really the need of the hour. And this is something, cosmetic procedures and cosmetic surgeries is something like most of us will now have to join in, even those who have not been doing it in the past few years. So very, very timely. And thank you, Chitra ma'am.
Yeah.
Thank you so much.
So I
This
think
also brings to that problem which Dr. Chitra ma'am asked in the beginning, that how are we as oculoplastic surgeons are placed in the world of cosmetic surgeries when generally the patients go to dermatologists, plastic surgeons, and cosmetologists. I still don't know how should we, take the fair pie from that cake of cosmetic surgeries and plastic surgeries from our other colleagues.
Yeah, but Shubhra was trying to tell me that the patient just walks into a clinic and they know the difference. So I decided that I will end this session believing that, and when you believe something positively, it actually happens. So, but anyway, I think we are running quite late, and I think I realized even more today that beauty and cosmesis is actually a rave for all generations, and the kind of explosion of information and learning which came in would actually haunt us to hear some more of your meetings and get more knowledge, though I would never subject myself to any of these things. Believe me, I also realize that such phenomenal dedication is there amongst you, all of you, because there's a lot of dedication needed to go and redefine something, and there could be some unpredictable associated with it. But hats off to you, expert panel, for your contributions and amazing set of talks by each of you, the most challenging videos and the different things. I'm not going to take the names, but each talk was one to beat the other. And thanks a lot, Dr. Shubhra, for being the true co-moderator, which I needed for this very interesting webinar. My very special thanks to my ARC team for always being there in the background to support me and in the forefront to support me. My thanks are due to Kripal and the entire AIOS admin staff. My thanks are due to Sai and Manjula from Numerotech. I'm sure your inboxes are filled with these ARC emails, and the thanks goes to them. And our thanks are very much due to Dr. Anand Sethi and his team. And you can see how intensely involved they are. I think they need to be given some kind of honorary qualification for having done so much for ARC webinars in the last 1 year. And most importantly, our thanks are very, very much due to our sponsors, the Entored Pharma, who have been there all through my term, and the kind of amazing support they've given is just phenomenal, which always encouraged us to keep coming back. And thank you so much, dear attendees, for you being there, because that only makes us think of how innovative and how different and how interesting we can ever get. And thank you, one and all. Thank you so much. Thanks a lot.
Thank you so much, ma'am. Thank